Hi, good afternoon, all student, nursing student. Today I'm going to teach you type of isolations because many students fail this concept in the Nclex test. Okay, today I'm going to teach you type of isolations. Okay, be ready for that. Before I start, I can tell all students who bought my books, thank you very much. I have more than 50 students who already bought their books. Okay? All right. Let's start, class. Let's start. Let's see some questions. All right, type of isolation. In nursing, isolation is critical practice to prevent the spread of infection disease. Okay, this is a very important concept for all students to know. There are several types of isolation precaution, each designed to protect patients, healthcare workers, and visitors from infection. It is important. Okay, let's see the first precaution. We have standard precautions that are used for all patients, regardless of their infection status. Okay, all employees and patients must be careful. Okay, with the precaution. They include practices such as hand hygiene. Okay, you need to wipe your hand before and after you uh, uh, be with the patient. Using personal protective equipment, PPE is very important also. Okay, this is very important. When necessary, safe injection practices and proper handling of potential contaminated equipment or surfaces. It is very important to take caution with those, with patients because standard precaution is very important to use. It's not only for patients, but for all employees also. Okay. Second, contact precautions because in your test they're gonna ask you questions regarding this precaution. Very important. Make sure you master them before you go to take the test. Okay, guys. Contact precautions they are used for infections spread through direct or indirect contact. Okay. Contact precaution not only you can be close to the patient, but you should not be close, and then you can still get the get problem. You can still get affected. That's the reason why you need to be careful. Okay. For example, patients with RSA. So you need to be careful with those patients. Okay. So would be placed on the contact precaution. So they can ask you questions regarding which patient should be placed in contact precaution, which patient would be placed in, for example, you can say standard precaution. You should know the difference between standard precaution and contact precaution. Contact precaution, you see as the name sounds, contact. Okay, you close to the patient, very close. Okay, so you need to know the differences between those two things. All right, the third one is droplet precaution. Droplet precaution, they usually ask this question in the English test. So droplet precaution, as the name sound droplet, so the patients uh, can cough and then you get infected because you close to the patient. We call droplet precaution. Okay, they are required for infection that are spread through respiratory droplet. Patient are coughing, you close to the patient, then you get infected, such as influenza, the flu. The flu is very contagious, so if you stay close to the patient, you will get infected. So, influenza or whooping cough, the patient cough in front of your face, you can get infected. Make sure you wear a mask. Okay, make sure you wear a mask. They're gonna ask you this question. Make sure you know. Healthcare workers should wear masks and sometimes eye protection. Make sure you wear a glasses, a glasses, because if you don't wear the glasses, you can get infected because of the patients with through the droplets to you, okay, to your face. Make sure you do that, guys. Make sure. Okay, very important. Airborne precautions. Ah, I cannot count how many times student tells me this get this question. I didn't sound airborne. Airborne precautions. Ah, this is important. Airborne precaution gonna stay in that room for a long time, for a long period. Make sure you disinfect this room or you clean this room, okay, so that you cannot get infected. Airborne precaution. These are used for infections that are spread through airborne particles that can remain suspended in the air for a long period. So don't shut this room. You have to disinfect this room before you get even into that room to do the care, because there should be a airborne precaution. There should be a germs in this room for a long period, guys. Okay, you know that. These precautions include the use of N95 in order to, to avoid taking this sickness. You need to wear a N95 respirators. So this is very important. This is serious, guys. I cannot count how many nurses who get infected because they forget if there were some infected patient in a room. So they go clean, they go do stuff, and then they get infected because the germs have been there for long times. Okay, make sure you be careful with the precautions, guys. The precautions are very important. They're gonna ask you question about airborne precautions and then droplets precaution, okay, and then also contact precaution. They're gonna ask you question which patient require contact precaution, which patient required also in droplet precaution. If you know really well those precautions, you will answer this question. Okay, trust me. Yeah, you will answer this question. Yes, you will. So thank you very much. Other video I'm gonna do soon is the video where we will answer questions on infection control, just to know if you understand. Okay, the infection control. Thank you very much, guys. Thank you.